Matt Costa from Oxford. You've just been having your presentation here at the FFN-kongressen in Oslo. Could you please give us a few minutes of your time to explain the most important takeaways from your presentations here today?
So thanks, Lars. Yes, I was talking about an injury to the hip called an intracapsular fracture, which affects about half the patients with a hip fracture all around the world, so millions and millions of patients every year. And the discussion was really about what type of implant we use to replace that bit of the broken bone. So for intracapsular fractures, the bone tends not to heal very well if we fix it. It's to do with the blood supply. So we tend to replace that bit of the bone with a hip replacement of some sort. And the question was, what sort of hip replacement and how do we fix it to the bone? So there were three key pieces of information. The first was from a trial called HealthTalk, run by colleagues from North America and including centres all around the world, including here in Norway. And that compared total hip replacement to half a hip replacement, a hemiarthroplasty, and found that actually for most patients, a hemiarthroplasty, a simpler, quicker operation, actually does just as well as a full hip replacement. The second bit of evidence was about how to fix that hip replacement, that half hip replacement, to the bone. And a study that we ran from the UK actually demonstrated quite clearly that if you fix the bone or fix the implant to the bone with bone cement, like a grout, then actually they got better functional outcomes with lower complications and it was much cheaper. And then the final bit of evidence, which was the latest study we published in the Lancet journal, was about what sort of bone cement we use for that sort of cemented hemiarthroplasty. And the latest data suggests that actually a simple standard bone cement with just one antibiotic in it is just as effective at reducing infection as a dual high-dose antibiotic. So overall, we recommend cemented hemiarthroplasty with a single dose of antibiotic cement for most patients with that sort of injury.
How do you think this will apply to the clinical everyday life now for the clinicians when they're taking this home to their patients?
Well, hopefully it's quite clear to policymakers and clinicians as well that a cemented hemiarthroplasty is not only a quicker, simpler operation for the patient, but also a cheaper operation for the healthcare system. The implants are cheaper and the length of stay is shorter, so reduces overall healthcare costs. So hopefully this is an open door and clinicians will be able to push this evidence to the forefront and hopefully treat our patients not only better, but also a more cost-effective way.
Last question, what do you hope to get away from this Congress here in Oslo this next few days?
So I'm an orthopaedic trauma surgeon by trade, but I love this meeting because I get to hear from all the other specialties involved in looking after older patients with broken bones. So the geriatricians, the nurses, the therapists, the scientists, and so I'm going to pick up lots and lots from them outside of my own field. That's what I'm looking forward to.